This question has been vexing one to both clinicians and public health practitioners since the adverse effects of smoking became known to us. The answers to these questions are perhaps as varied as our patient population, with a variety of different factors that are important. Tobacco use has many features of a complex chronic illness. In cigarette smoking, there is evidence that genetic factors, early life exposures, and environmental factors, which means living in an area that restricts smoking or heavily taxes cigarettes. These factors influence smoking uptake and cessation. One reality is that not all of our patients, even in the face of debilitating disease, want to stop smoking. The reason for this are not completely clear and may be in large part related to the addictive nature of smoking. Other potential explanations are that these patients receive that, and at least for them, the benefits of smoking outweigh the risks. Some of these patients are completely aware of the problems related to smoking, but have decided that they are so unhappy if not smoking that they decide to continue. In other cases, people may have developed a terminal disease, such as metastatic lung cancer, and the comfort of continuous smoking outweighs, at least for them, any benefits of stopping.
Smoking cessation is hampered by the lack of motivation to quit smoking, as well as the formation of psychological and physiological addictions. Smoking is a way to deal with the daily stress, which is generally cheaper than doing sports with a trainer or sessions with a psychologist.
One option is to use tobacco products that pose a lower risk of tobacco-related disease or are less harmful than one or more other products. But it's important to understand that this is a temporary measure that does not negate the fact that the patients need support for complete smoking cessation.
Recent clinical studies have shown that switching from cigarette smoking to e-cigarettes poses a lower risk of harm and may reduce a risk of smoking-related diseases, such as cardiovascular diseases. Also, it's recommended to avoid smoking in the car and in residential areas.
We should accept that there is a category of smokers who are not motivated to quit smoking, and they are not affected by current bans. The medical community and the government should take this fact into account and work not only on prohibitions, but also other alternatives that will help smokers make an informed choice on their own. The goal of the medical community is to adapt existing clinical recommendations, taking into account the scientific approach to harm reduction and the availability of less harmful alternatives.
What should doctors and the state do? I think that the most important for the doctors is to know and to understand the main principles of motivational consulting and nicotine replacement therapy for their addicted patients. Doctors should also understand the main medical benefits of switching on tobacco heating systems and other concepts of harm reduction. At the state level, we should adopt strategies to improve the living standards of our society and support the existing legislative acts on the prohibition of tobacco consumption in public places and also for children. But still, we see that no one in Russia is simply frightened by prohibitions. That's why we should find a way to increase the awareness of the end users of tobacco about the products with lower risk. Adopting the best practices all over the world, we can reduce the number of smokers in our country by introducing innovative technologies that minimizes risk and increases the availability of safer alternatives.